Hi and welcome back to another video of Medic Notes. This video is on degenerative disc disease. Degenerative disc disease refers to the natural deterioration of the intervertebral disc structure, such that they become progressively weak and begin to collapse. It is often related to aging. The factors which precipitate damage to the intervertebral discs include progressive dehydration of the nucleus pulposus, daily activities causing tears in the annulus fibrosus, injuries or pathology resulting in instability, such as spinal fractures, spinal surgery, or osteoporosis. For pathophysiology, the cascade of changes seen in degenerative disc disease can be subdivided into 3 stages, which are dysfunction, instability, and restabilization. Dysfunction refers to outer annular tears and separation of the end plate, cartilage destruction, and facet synovial reaction. Instability refers to disc resorption and loss of disc space height, along with facet capsular laxity, can lead to subluxation and spondylolisthesis. Lastly, in restabilization, degenerative changes lead to osteophyte formation and canal stenosis. Clinical features. Early-stage disease symptoms are often localized, and the clinical examination may be unremarkable. Potential signs include local spinal tenderness or contracted paraspinal muscles, hypomobility, or painful extension of the back or neck. In later stages, the pain may become more severe and include radicular leg pain or paresthesia. Pain may be reproduced by passively raising the extended leg, which means positive Lasegue sign. Further disease progression may demonstrate signs of worsening muscle tenderness, stiffness, reduced movement, particularly lumbar region, and scoliosis. I will talk a bit on Lasegue test, also known as straight leg raise test. This test is used to assess for disc herniation in patients presenting with lumbago. With the patient lying down on their back, the examiner lifts the patient's leg while the knee is straight. The ankle can be dorsiflexed, or the cervical spine flexed for further assessment. A positive sign is when pain is elicited during the leg raising with or without ankle dorsiflexion or cervical spine flexion. For investigation, spine radiographs are only recommended if the patient has a history of recent significant trauma, known osteoporosis, or aged over 70 years. An MRI spine is the gold standard investigation for suspected degenerative disc disease warranting imaging, however the majority of cases do not require imaging. This picture shows a sagittal cervical spine MRI, demonstrating degenerative disc disease, osteophytes, and osteoarthritis of C5 to C6. For management, in the acute stage of disc disease, adequate pain relief is the mainstay of treatment. Simple analgesics should be used first line, with neuropathic analgesics as adjuncts if required. Encouraging mobility within patient limits is recommended for the treatment of acute low back pain, with physiotherapy for strengthening exercises. If pain continues beyond 3 months, despite analgesia, referral to the pain clinic may be required. Although spinal fusion has previously been suggested for chronic low back pain, there is no evidence to support surgical intervention. That's all for this video. Thank you.